deep inside the suffocating shadows of prehistoric caves. Thousands of years before the first medical textbooks were ever written, humanity fought a terrifying war against invisible agony. To our Neolithic ancestors, an unbearable migraine or a violent epileptic seizure was not a biological malfunction. It was a literal invasion. They believed that malevolent spirits, trapped inside the bone, were scratching at the walls of the brain, screaming for an escape. To release these demons, tribal shamans did not offer prayers or herbs. They turned to violence. Armed with nothing but jagged pieces of obsidian and razor-sharp flint stones, they developed the world's oldest surgical procedure, trepanation. Without anesthesia, without sterile tools, and wrapped in the suffocating smoke of ritual fires, the healer would press the sharp stone directly against the trembling patient's bare, bloodied scalp. The mechanics of prehistoric surgery required brutal, agonizing endurance. Using a scraping or drilling motion, the shaman worked for hours, carving directly through the skin, muscles, and thick layers of the human skull. The sound of flint grinding against living bone echoed through the cavern. 1 millimeter too deep, and the stone would pierce the brain's protective membrane, causing instant death. Yet they kept digging, desperate for a doorway. When the stone finally broke through, creating a circular window into the skull, a rush of blood and pressure was released. To the tribe watching in awe, the steam rising from the open wound was the literal departure of the evil spirit. But the true miracle of this ancient horror is not the ritual, it is the biological reality. Modern archaeology has unearthed thousands of these skulls, and the evidence left in the bone is absolutely staggering. Looking through modern microscopes, scientists discovered something impossible: smooth, rounded, and perfectly healed bone edges. This means these prehistoric patients did not just survive the agonizing torture of having their heads carved open with stones. They lived for years after the ritual. The human body's capacity to endure infection and heal its most vital shield in a filth-ridden Neolithic world defies everything we thought we knew. As thousands of years bled into antiquity, the practice of trepanation did not vanish, evolved into something far more calculated, yet equally terrifying. Roman gladiators with crushed skulls and medieval soldiers with festering head wounds were dragged onto heavy wooden operating tables. The mystical belief in escaping demons was slowly replaced by an early, primitive understanding of physical compression. Healers realized that an impact to the skull caused a deadly buildup of dark fluid. To relieve this agonizing internal pressure, the tools became industrialized. Flint stones were replaced by the Trifina heavy, cold iron drill with a sharp, circular saw blade at the tip. Inside dark, poorly ventilated medieval sanatoriums, surgeons would place the center pin of the drill directly onto the patient's exposed bone. With a slow, squeaking, rhythmic twisting motion, the metal teeth would bite into the skull, producing a pile of pale bone shavings. But this evolution came with a devastating, bloody toll. In the filth-ridden medical landscape of the Old World, the survival rates plummeted significantly compared to the Neolithic era. Hospital gangrene, unwashed hands, and non-sterile metal tools meant that opening a doorway into the skull was almost always an invitation to a lethal infection. The brain's delicate defenses were exposed to a storm of invisible pathogens, turning a desperate cure into a death sentence. The psychological terror of undergoing this procedure while fully conscious was absolute. Patients were pinned down to the blood-stained wood by multiple assistants, their screams echoing off the stone walls. The unyielding mechanical vibration of the iron drill, shaking the entire skeletal structure, created an internal horror that few could endure. It was a brutal gamble between immediate death from pressure or a slow, agonizing demise from brain rot. For centuries, this crude mechanical drilling remained the absolute peak of neurological intervention. It was a dark, stagnant era where medicine could only offer a violent hole in the dark to solve the complex mysteries of human consciousness. The skull was treated not as a sacred shield, but as a stubborn stone vault that needed to be cracked open with brute force. The price of survival was paid in bone dust and blood. The clock continues to tick. The arrival of the 20th century completely shattered this primitive, bloody paradigm. The twin revolutions of anesthesia and Joseph Lister's antiseptic protocols transformed the operating room from a house of torture into a sanctuary of science. Surgeons no longer used brute force or jagged stone tools to crack open the human vault. They began to understand the delicate architecture of the brain, realizing that access to consciousness required absolute microscopic reverence. This radical scientific dawn permanently replaced the crude, blind drilling of trepanation with the modern craniotomy. The objective remained fundamentally identical to the ancient Neolithic instinct: to relieve life-threatening pressure within the skull caused by trauma or tumors. But the execution was entirely reborn. The violent hole in the dark was replaced by a precise, temporary bone flap, carved with surgical lasers and high-speed cranial drills. Today, the procedure is an exquisite masterpiece of technological and human synergy. Inside contemporary neurosurgical suites, computer-guided navigation systems map the patient's brain in real time, down to a fraction of a millimeter. Surgeons wear high magnification loupes, working under bright, cool LED arrays. The modern skull is treated as a sacred, complex shield, opened with flawless precision to save the mind without damaging the soul. The stark contrast between the prehistoric cavern and the modern operating theater is the ultimate testament to human progress. We no longer chase away imaginary demons with jagged pieces of volcanic flint. We relieve real physical compression using sterile titanium plates and specialized micro screws. Yet every single time a neurosurgeon carefully relieves pressure from a swollen brain today, they are executing the exact same survival instinct born in the dark. The ancient shamoons and their agonizing stone tools were the brutal, unyielding foundation upon which modern neurosurgery was built. We walked through the flickering firelight of primeval caves and the infection-ridden sanatoriums of the past to reach this pinnacle of clinical safety. The price of our understanding was paid in bone dust and ancient scars. But today, the lesson is carved in stone. True medicine turns horror into healing. The clock has stopped. Thank you for traveling back to this dark era with us. What part of medical history shocked you the most? Leave your thoughts in the comments below. Don't forget to like this video and share it with other history lovers. This was Morbid Medicine, and we will see you in our next Dark Archive.